Dr. Arion. Senior Health Education.
There is a number I want you to hear before anything else. 38%. That is the death rate of a virus currently circulating across the United States right now. A virus that your doctor has probably never mentioned to you, that the news has largely moved past, and that the majority of men over 45 have never had a serious conversation about. For context, COVID-19, the virus that shut down the entire country, that closed schools and businesses and filled hospitals past capacity, carried a death rate of roughly 1 to 1.5% across the general population. 38% versus 1.5%. If that gap does not immediately make you want to understand what we are talking about, nothing will. So stay with me, because over the next several minutes, Dr. Arion is going to walk you through exactly why this virus is more dangerous than COVID for men in your age group, what it does inside the human body, and what your actual personal risk looks like starting right now. Welcome, or welcome back, to Senior Health Education. If you are new here, this channel exists for one purpose: to give men over 45 the kind of clear, honest, science-based health information that does not get watered down or buried. If that matters to you, hit subscribe right now and tap like before we go any further. It costs you nothing, and it helps this information reach the men who genuinely need it. Now let us get into why that 38% number matters so much, and why the comparison to COVID is not fear-mongering. It is just math. The virus is called hantavirus. And before you half remember a headline from 30 years ago and decide you already know enough, stop. Because what you think you know about hantavirus is almost certainly outdated, missing critical context, and completely disconnected from the data that makes this virus specifically dangerous for men over 45. The 1990s outbreak in the American Southwest put hantavirus briefly on the public radar, and then the radar moved on. The virus did not. It has continued circulating, infecting, and killing. The science has continued accumulating, and the picture that science paints, particularly for men in the 45 to 65 age range, is one that deserves a full, serious conversation. So here is where we start. The comparison to COVID. Because COVID is the reference point most of us now use internally when we evaluate whether a virus is worth taking seriously. And by that reference point, Hantavirus Pulmonary Syndrome, the primary form of this virus in North America, is in a completely different category. Let us lay the numbers directly side by side. COVID-19 in the United States, across the full span of the pandemic and accounting for all variants and all age groups, carried an overall case fatality rate of approximately 1 to 1.5%. In the worst periods, early 2020, before vaccines, before improved treatment protocols, when hospitals were overwhelmed, that number climbed toward 2 to 3% in the general population. For men over 65 with serious underlying conditions, it reached higher. And those numbers were enough to fundamentally alter daily life in this country for more than 2 years. Schools closed, businesses shut down, travel stopped, the economy contracted, hundreds of thousands of people died. That was the impact of a virus with a case fatality rate under 3%. Hantavirus Pulmonary Syndrome carries a case fatality rate of approximately 38%. In some documented cluster outbreaks, that number has touched 40%. Nearly 4 out of every 10 people who develop the full pulmonary syndrome do not survive it. That is not a minor statistical difference from COVID. That is a chasm. And yet there is no national mobilization, no public awareness campaign, no daily briefing. Understanding why that asymmetry exists, and why it does not make hantavirus less dangerous to you as an individual, is the first thing we need to address. The reason the public health response to hantavirus looks so different from COVID comes down to one word: transmissibility. COVID spread between people with extraordinary efficiency. One infected person in a typical indoor space could expose an entire room full of people through respiratory droplets in shared air. That speed and ease of spread was the engine of the pandemic. It was what turned a serious but manageable virus into a global catastrophe measured in millions of deaths. Hantavirus, in virtually every known North American strain, does not spread between people in any meaningful way. You cannot catch it from an infected person. Not from a cough, not from shared air, not from physical contact. The human-to-human transmission that made COVID impossible to contain simply does not exist with hantavirus in the way people typically encounter it. And that is why we are not in lockdown. That is why the containment approach looks completely different. The transmission pathway is narrow and specific, which makes the exposure preventable in ways that COVID never was. But here is exactly where most of the reporting on this virus stops, and where the most dangerous misunderstanding begins. The absence of person-to-person transmission does not make hantavirus less lethal to the individual who is exposed. It makes it more predictable in terms of where exposure happens. It does absolutely nothing to reduce what this virus does to the human body once it gets inside. The 38% fatality rate is not a function of how widely the virus spreads. It is a pure, direct measurement of what happens to human physiology when this pathogen establishes itself. And on that measure, individual lethality, Hantavirus Pulmonary Syndrome sits in a category that COVID, for all the devastation it caused, never approached. If you were exposed to hantavirus and developed the full pulmonary syndrome, your odds of survival without intensive medical support would be worse than a coin flip. That is the number the headlines leave out. That is the number every man over 45 with any environmental exposure risk deserves to hear clearly and completely. Now let us talk about the mechanism, because the biology of how this virus operates is not just scientifically interesting. It is practically critical. Understanding what hantavirus does inside the body is what allows you to recognize a dangerous situation before it becomes irreversible. Hantavirus enters the human body through the respiratory tract. No bite required. No direct contact with a rodent, living or dead. The only thing required is that you breathe in air containing microscopic particles of dried infected rodent urine, droppings, or saliva. In any enclosed space where rodents have been active, a hunting cabin sealed for months through winter, a garage with evidence of mouse presence, an attic, a barn, a storage shed, a basement storage area, those particles exist. They dry on surfaces, they mix with dust, and when that dust is disturbed, those particles go airborne. You walk into that space, you start moving boxes, opening containers, sweeping a floor, and you breathe in particles that are invisible, odorless, and carry no physical sensation of any kind. The exposure is completely silent. You feel nothing. You leave feeling fine. And for the next 1 to 8 weeks, you continue feeling fine, with no awareness that a biological sequence has been initiated inside your respiratory system that could become life-threatening. This is what I call the invisible exposure problem. And it is the single most important concept to understand about why this virus is so uniquely difficult to defend against once you are in the wrong environment. Once those aerosolized particles reach the lungs, the virus begins targeting the cells that line the small blood vessels deep in the pulmonary tissue, the capillaries that form the delicate vascular infrastructure of the lungs. This is not a surface-level infection. This is a direct attack on the structural architecture that allows your lungs to exchange oxygen with your blood. As the virus replicates and the immune system responds, the walls of those tiny blood vessels become inflamed and permeable. They begin to leak. Fluid that belongs in the bloodstream starts seeping into the lung tissue itself. This process, pulmonary edema, is what drives the lethal phase of the disease. And it can escalate with speed that most people and many physicians outside of high-risk regions are not prepared for. For the first few days after symptoms appear, the patient feels like they have a severe flu. Fever of 101 to 104 degrees. Deep muscle aches, especially in the back, thighs, and shoulders. Exhaustion that makes getting out of bed genuinely difficult. Headache. Sometimes nausea. Most men, especially men who have spent their lives pushing through illness, who do not immediately see a doctor at the first sign of discomfort, manage this phase at home with rest, fever reducers, and fluids. They assume they are dealing with a bad seasonal bug. And for the vast majority of illnesses that present this way, that is the correct approach. With Hantavirus Pulmonary Syndrome, managing that phase at home without the connection being made to a potential rodent exposure is the critical error. Because what is happening under the surface during those first 3 to 5 days is not the virus running its course. It is the virus actively establishing itself in the lung tissue and setting up the rapid, severe deterioration that follows. By the time breathing becomes labored, by the time the patient recognizes that something more serious than the flu is happening, the disease is already in its most dangerous phase. And from that point, the window to critical respiratory failure can be measured in hours, not days. The incubation period makes this even more treacherous. Between the moment of exposure and the appearance of the first symptoms, hantavirus can remain entirely silent for anywhere from 1 week to 8 weeks. 8 weeks. During that entire period, the person feels completely normal. They live their life without any indication that anything is wrong. And then symptoms appear, often abruptly, and often already at an advanced stage. The mental connection between cause and effect, between the afternoon 6 weeks ago when you swept out the hunting shed and the fever and muscle pain that started yesterday, is almost impossible to make without being specifically aware of this disease and this incubation window. Most people do not make that connection. Most emergency room physicians, unless they are working in a region with established hantavirus history, or unless the patient specifically mentions potential rodent exposure, do not immediately include Hantavirus Pulmonary Syndrome in the differential diagnosis. That gap between what actually happened and what the treating physician understands can be the decisive factor in whether a patient lives or dies. This is the part of the conversation where we need to talk specifically about men over 45, because the risk profile for this age group is not simply older people get sicker. It is a set of specific, measurable biological factors that interact directly with the specific mechanism by which hantavirus causes damage. The first factor is immune function. The immune system of a healthy man in his late 40s or 50s does not operate with the same speed and precision as it did in his 20s or 30s. This is not pathology. It is a normal, documented biological process called immunosenescence, the gradual aging of the immune response. The cells responsible for identifying and responding to novel pathogens, T cells, natural killer cells, the components of the first response immune cascade, begin to operate more slowly and less precisely. For everyday pathogens, this reduced efficiency rarely matters much. A cold lasts a couple of days longer. But Hantavirus Pulmonary Syndrome is not an everyday pathogen. It moves fast, attacks critical vascular tissue, and can escalate to life-threatening severity within a narrow time window. In that context, an immune response that takes an extra day or two to fully mobilize is not a minor inconvenience. It is a clinical variable that can determine the outcome. The second factor is cardiovascular baseline. By the mid-40s, most American men have accumulated some degree of cardiovascular change, even men who consider themselves healthy and do not have a formal cardiac diagnosis. Arterial stiffness, reduced cardiac output reserve, and in many cases early-stage hypertension or metabolic conditions that have not yet been formally identified. These changes matter specifically with hantavirus because the lethal mechanism of this disease is fluid accumulation in the lungs. It is a direct assault on the cardiopulmonary system. A heart and pulmonary system already operating with reduced reserve capacity have significantly less ability to compensate when hantavirus begins driving fluid into lung tissue. A young man with a healthy cardiovascular baseline may be able to sustain adequate oxygenation as pulmonary edema develops, buying critical time for medical intervention to work. A man in his mid-50s with unmanaged hypertension and reduced cardiac reserve may not have that buffer. The margin between severe and fatal narrows considerably. The third factor is chronic inflammation driven by visceral fat. This is the body fat stored deep in the abdominal cavity around the organs, not superficial fat, but the deep, metabolically active fat that accumulates in the midsection as men age. By the mid-50s, the majority of American men carry a clinically significant level of it, whether or not they would describe themselves as overweight. Visceral fat generates a state of persistent, low-grade systemic inflammation. And that chronic inflammatory background does something specific and harmful to the immune response against acute pathogens. It creates a form of immune exhaustion. The system has been running a low-level inflammatory response for so long that when a serious acute threat arrives, the controlled cascade that should be the appropriate response can become dysregulated. With serious respiratory viruses, this dysregulation can manifest as an overreaction where the immune system causes more damage to the body's own tissue than the virus itself. Evidence in the literature suggests that the severity of pulmonary injury in serious hantavirus cases is at least partially driven by this kind of inflammatory dysregulation, and the men most vulnerable to it are precisely the men carrying the highest visceral fat burdens. The fourth factor is sleep. Sleep quality and duration in men over 45 decline meaningfully compared to earlier decades, and this is not simply a comfort issue. Sleep is the primary window during which the immune system performs its maintenance, calibration, and readiness functions. A man chronically sleeping 6 hours or less, which describes a substantial percentage of working American men in their late 40s and 50s, is running an immune system at measurably reduced preparedness every single day. For ordinary seasonal pathogens, this rarely tips the balance. But for a fast-moving, high-lethality respiratory virus, reduced immune preparedness is a real clinical liability that belongs in the risk assessment. Now let us make all of this directly useful, because everything we have covered so far is context, and context without application is just information. The first and most important practical step is what I would call an honest environmental inventory. Think about every enclosed space in your life where rodents could have been active, and where you have not implemented any specific precautionary protocol. A hunting cabin that gets opened once a year, a detached garage sealed through the winter, a basement storage area that has not been thoroughly gone through in 2 or 3 years, a barn, a shed, a storage unit you rent and visit occasionally. For men over 45 who own or access rural or semi-rural properties, these environments are not exotic. They are just part of life. The shift that needs to happen is recognizing that entering and cleaning these spaces without taking specific precautions is a documented risk, not a theoretical one, not an absurdly remote possibility, but a specific, well-characterized exposure pathway that has killed American men in exactly the demographic watching this right now. The protocol for managing that risk is simple and does not require specialized training or expensive equipment. Before you enter any enclosed space where rodent activity is possible, and the signs to watch for are droppings, nesting material from shredded fabric or paper, gnaw marks on wood or plastic, or the distinctive musky smell of an active rodent presence. Open every available door and window and allow the space to ventilate for a minimum of 30 minutes before you go in. Do not skip or shorten this step. The ventilation is not optional. It dramatically reduces the concentration of aerosolized particles in the air. When you enter, wear an N95 rated mask, not a surgical mask, not a cloth covering, an N95, rated to filter 95% of airborne particles, including the dried excretion particles that carry the virus. Prepare a solution of 1 part household bleach to 10 parts water before you touch any surface. Spray all surfaces before wiping them. Wet everything down thoroughly first. Never dry sweep. Never use a standard vacuum without a HEPA filter in that kind of space. Dry sweeping and standard vacuuming are among the highest risk activities because they actively launch settled particles into the air at breathing height. These precautions are not burdensome. They add minimal time and require supplies most men already have or can easily obtain, but they directly address the specific mechanism by which this virus reaches human lung tissue, and they work. The second critical practical step is knowing the symptom sequence precisely and knowing when to stop waiting and move. If you develop fever, significant muscle aches, and any progressive shortness of breath within 1 to 8 weeks of any potential rodent exposure, you go to an emergency room. Not an urgent care clinic if your breathing is compromised, not a scheduled appointment for later in the week. An emergency room directly. And when you arrive, you say these specific words: I had potential contact with a rodent-contaminated enclosed space within the past 2 months, and I am concerned about hantavirus exposure. That sentence changes the diagnostic process immediately. It tells the treating physician to include Hantavirus Pulmonary Syndrome in the differential and to monitor you for the kind of rapid pulmonary deterioration that characterizes this disease. Without that information, the working diagnosis will almost certainly start with influenza, COVID, bacterial pneumonia, common, reasonable assumptions for a middle-aged man with fever and a cough. The window between early symptoms and critical respiratory failure in severe hantavirus cases is narrow enough that a diagnostic delay can be the decisive factor. Say those words. It costs you nothing and it can change everything. The third area of practical action is addressing the specific physiological risk factors that determine how your body responds when a serious pathogen arrives. We covered 4 of them: immune surveillance, cardiovascular reserve, visceral fat and chronic inflammation, and sleep. Sleep is the one most immediately in your control and the one with the most well-documented direct effect on immune function. Consistently getting less than 7 hours puts you at measurably reduced immune readiness every day. For men with any realistic environmental exposure risk, getting to 7 hours of quality sleep is not a lifestyle preference. It is a clinical priority. Visceral fat reduction, through regular resistance training, managed carbohydrate intake, and attention to blood glucose, directly reduces the chronic inflammatory state that impairs immune response and raises the risk of immune dysregulation during serious infection. This is not about appearance. It is about the specific biological conditions that determine outcomes when a serious pathogen enters the picture. Vitamin D deserves its own mention here because its role in immune function is both extensively documented and dramatically underappreciated in the male population over 45. Somewhere between 40 and 60% of American men over 50 are deficient or insufficient in vitamin D, even in sunnier states. Vitamin D directly influences the production and activity of antimicrobial peptides in the respiratory tract, which is exactly the tissue that hantavirus targets first. If you have not had your 25-hydroxyvitamin D level tested recently, ask your doctor to order it at your next visit. The optimal range is generally considered 40 to 60 nanograms per milliliter. Many men who consider themselves healthy are sitting significantly below that, with real but invisible consequences for immune readiness. Blood pressure management belongs in this conversation for the same reason. Uncontrolled hypertension directly reduces the cardiovascular reserve that determines how well your heart and lungs can compensate when this virus begins its assault on pulmonary vascular tissue. If your blood pressure is elevated and not well managed, that is not a background detail. In the specific context of hantavirus risk for a man over 45, it is a direct component of your vulnerability profile. Now let us be precise about the overall risk picture, because this conversation is designed to calibrate your awareness, not generate generalized anxiety. Hantavirus Pulmonary Syndrome does not infect millions of Americans each year. The CDC tracks somewhere between 20 and 50 confirmed cases annually in the United States. If you live in a dense urban environment, have no access to rural properties, and spend no time in the kinds of enclosed spaces we have been discussing, your individual risk is genuinely and meaningfully low. But two things complicate that reassurance for a significant portion of this audience. First, confirmed CDC case counts almost certainly represent an undercount of actual infections, because hantavirus in its early stages is clinically indistinguishable from influenza and is rarely the first diagnosis considered outside of high-risk regions. Second, the populations with the highest real-world exposure risk, men who hunt, who own rural properties, who work in agriculture, construction, or environmental management, who have outbuildings or storage spaces that have not been recently cleaned, are not a small or exotic group. They are a large and very specific slice of the male over 45 demographic in the United States. For those men, the distance between their daily lives and a potential hantavirus exposure is not theoretical. It is measured in how recently they last walked into a space that had been sealed for a season. There is also a geographic dimension to this that rarely gets discussed with any specificity. Hantavirus risk is not uniformly distributed across the country. The deer mouse, the primary carrier of hantavirus in North America, is found across virtually the entire continental United States, not just in remote wilderness or high-altitude environments. It is present in suburban and exurban settings, in older residential structures, in the kinds of outbuildings and storage facilities that exist on properties across every region of the country. The western United States, particularly the Rocky Mountain states and the desert Southwest, historically shows the highest documented case concentrations. But confirmed cases have been recorded across the Southeast, the Midwest, the Great Plains, and the Pacific Northwest. Knowing the regional distribution matters because it helps you calibrate how seriously to take any specific space or situation in your own geographic area. One final comparison between COVID and hantavirus that almost never gets made, but that I think is genuinely important for this audience. During the pandemic, one of the most alarming discoveries was that COVID caused measurable long-term organ damage in a significant percentage of survivors. Patients who recovered from severe acute infection were found to have persistent lung impairment, cardiac muscle involvement, and neurological effects lasting months to years. The long-term data on hantavirus survivors, while less extensive simply due to fewer cases, tells a similar story. Survivors of severe Hantavirus Pulmonary Syndrome have been documented to experience persistent reduction in pulmonary function, reduced exercise capacity, and in some cases ongoing cardiopulmonary impairment that shapes quality of life for years after the acute phase resolves. For a man over 45 who is already managing some degree of age-related reduction in cardiovascular and pulmonary reserve, recovery from a serious hantavirus infection does not simply return him to baseline. It may permanently lower that baseline. That dimension, the life after surviving, does not appear in the mortality statistics, but it belongs in the full, honest picture of what this virus represents. Here is where I want to leave you. The 38% number is real. The comparison to COVID is not alarmism. It is an honest statistical comparison between two viruses using the same metric, and the result is striking. The specific physiological factors that make men over 45 more vulnerable to severe outcomes are real, measurable, and in several important cases, modifiable. The exposure pathway is narrow, specific, and, unlike COVID, largely preventable with straightforward precautions once you understand where and how it occurs. And the diagnostic window, from early symptoms to critical deterioration, is narrow enough that knowing the symptom sequence and the right words to say to an emergency physician is not a minor piece of trivia. It is potentially the most important information in today's conversation. Dr. Arion's goal in putting this together, the goal that drives every piece of content that goes out from senior health education, is that you leave this video with a clearer, more honest, more actionable understanding of your health than you had when you clicked play. If that happened today, this conversation did its job. Now I want to hear from you, and I am going to be direct about why it matters. Drop a comment right now and tell me where in the United States you are watching this from. Are you in the rural South, the Mountain West, the Pacific Northwest, the Midwest, the Great Plains, a major metro on the East or West Coast? It is not just a participation gesture. It genuinely shapes the content we build from here. Hantavirus risk, rodent population density, environmental exposure conditions, all of it varies significantly by region. When I know where this community is geographically concentrated, I can build out content that speaks directly to your regional risk profile rather than speaking in broad strokes. Your comment is useful. Leave your location. Tell me what landed for you today and tell me if a specific space or situation came to mind while you were watching, because I know for a significant percentage of you one did. If today gave you something real, if it shifted how you think about a space, a health factor, or a conversation you need to have with your doctor, share this video. Think about the man in your life who has a hunting cabin, a storage shed, a garage that has not been cleaned out in a year. Think about the man who considers himself healthy and well-informed, but who has never heard this specific comparison laid out clearly and completely. He needs this information as much as you did before you pressed play. Sharing this video with him is not a small thing. It is a genuinely useful act. Subscribe if you have not already, because the conversation we started today is one piece of a much larger picture. Next week, we are going deep into what the male immune system actually looks like at 45, 55, and 65, the documented decade-by-decade changes, and what the published science says are the most effective ways to close those gaps. Given everything we covered today, that video will be directly relevant to you. Do not miss it. This is Dr. Arion. Stay informed, stay rational, and never let fear or complacency be making your health decisions for you.